And for more on this, we're now joined by Nehawu, Northern Cape Provincial Secretary Moleme Moleme, and he joins us now via our video link. Moleme, thank you so much for your time this evening here in SABC News. I mean, we've just seen that report from my colleague there in Kimberley, and looking at the various challenges still facing this, hospital. How concerned are you as Nehawu from the problems being experienced in that hospital?
No, thank you very much, Mbali. Let us also greet the viewers at home. As now, we have always been concerned about the situation at the new mental hospital. Yesterday, we were basically celebrating 8 years of concerted worker struggle in the health department, which nearly reached boiling point, leading us into a standoff with the employer for almost 2 months. That was in 2016, raising the very same issues that we're experiencing, in particular in the health facilities, with a more focus on the new mental hospital, the decomplexing of the hospital to build capacity in delivering services such as finance, HR, issues around, quality health services for our people in the province, particularly in that facility, which has a bit of a history, and that history is actually unwelcomed from where we're sitting. So we are concerned about the situation, and more so the issue of 9 months where workers had to work in unpalatable situations, where there was no electricity in that institution.
And I mean, just looking at that report, 2 billion rand being spent when it comes to the construction of that hospital. But really, when it translates to the situation right now, one would also ask, it really makes no sense why, this hospital finds itself in this position.
Well, it does make a lot of sense, Mbali, especially if you look at how we do things. If we continue at the same trajectory of, doing things by the way, and there is no accountability, and subsequently there is no consequence management, we will always find ourselves in the situation where we have an institution that costed an arm and a leg to the public purse, and there is nothing that really, is forthcoming and is addressed in terms of staff shortage, in terms of, pajamas, for example, for patients, particularly female patients, and so forth. And generally, the poor state of the health facility, how it was constructed, infrastructural challenges, and we can't bypass that. And we've been raising this with government for some time to say we can't, after 30 years of the democratic breakthrough, find ourselves in this particular space. We must be able to remedy it. And we have been campaigning on an ongoing basis, holding picket lines, raising matters in various platforms.
I mean, as Nehawu, you see these problems on a daily basis. What sort of interventions would you like to see at this facility to ensure that, it does really deliver the services it has promised to the people of Kimberley?
Well, one of the issues that we want to be addressed urgently is the issue of leadership in the Department of Health itself. We need stability there. We need stability there and decisive leadership that is based also on innovation, on how to bring these deliverables to the fore. So let us start there, because we can deal with issues at an institutional level, but if there is no strong governance and accountability and consequence thereof, we will find ourselves in the situation. So ours is that there must be a high level of, and we think that it would be fostered by the element of political will to change the situation in that particular institution.
How important is this hospital to the people of Kimberley?
Well, it's very important, particularly being one of a kind a mental hospital. And the report is very clear. I mean, we welcome what the Human Rights Commission came to do, and we would like to invite other Chapter 9 institutions, even the Auditor General, just to zoom into the new mental, because we have a very few mental facilities, if none, of the kind of caliber of the new mental hospital. So that services is far and in between, and we are taking it lightly, coming from a social construct that continues to produce, mental illnesses um, through, the material conditions that our people find themselves in, including health situations. So mental health is very important, and we tend to treat it by the way, or sometimes even reduce it to a curse, without really dealing with scientific issues that are related to mental health. So it is important to have such a facility that would cater for our people, especially during the current situations that we find ourselves.
What is the provincial government saying, when it comes to the issues being faced by workers and being faced by the public at this hospital, this new mental hospital in Kimberley? And one would also ask, is government willing to address these challenges, or, are your pleas being fallen on deaf ears here?
Normally, I think there are engagements, there are ongoing engagements. Just 2 weeks back, we had a serious engagement with the MEC, the HOD, and other senior managers in the department about the regression that we are noting in the Department of Health, including the fact that there is a collapse in the Public Health Social Development Chamber, which is an important instrument in addressing challenges that workers are facing, such as the non-payment of overtime of our security guards at the hospital, and generally non-compliance with occupational health and safety. So there are ongoing engagement with the department. Our problem is that those engagements tend to be turned into a talk show rather than dealing with substantive issues and also witnessing decisive leadership that would, take us into confidence in turning the situation around. I mean, if you have a facility such as that continues to rely on what is COVID-19 brigades to clean the hospital, against the backlog that there is a shortage of cleaners,
Yeah.
a shortage of laundry aids, a shortage of porters, and what makes it worse, your COVID-19 relief nurses having to come in from time to time, high shortage of doctors. Just last year we lost 3. So you ask yourselves, what is the imagination of the department in dealing with this? Because we can't also shift the goalpost. We have a responsibility as leadership, in particular of the Department of Health, to come with possible solutions to deal with the situation that we are faced with. So it can be something that we pass the buck on, but we must take responsibility and come with ways of retaining staff and also, in a way, produce the necessary requisite skills also in the province.
All right, Moleme, thank you so much for your time this evening here in SABC News. That's Nehawu Northern Cape Provincial Secretary Moleme Moleme speaking to us about the findings from the South African Human Rights Commission there when it comes to the investigations being done at the Kimberley Mental Hospital.